Okay, Mikey, I want you to stand over there, honey, so I can take a picture, okay? Right there. Okay? Okay. Lean up against it for Grandma. Hold still.
Specks in front of our eyes, a cause for alarm. But these spots, called floaters, very likely will not cause blindness, nor seriously hamper one's eyesight.
Smile.
To understand why a person sees floaters, it's important to be familiar with the major elements of the eye. In its most basic sense, the eye is like a camera. The cornea and lens in the front of the eye function like a camera lens for focus. The retina in the back of the eye records the image, as does film in a camera. But this is where the similarity ends. In the middle of the eye, between the lens and the retina, is a relatively large space filled with vitreous gel. The vitreous gel provides a mass which gives the eyeball its shape and size. In a young person, the gel is thick and holds strongly to other structures, including the optic nerve, the retinal blood vessels, and the outside edges of the retina. As we age, the vitreous gel becomes less jelly-like and more liquid. At some point, when pockets of liquid develop, small particles which were sitting still in the gel out of the line of vision become free and begin to float around. These particles were always in the eye, but their new movement makes them visible for the first time. These things are called floaters. They appear in a variety of shapes: spots or flecks, spider webs or grids, wavy lines, or little strings. Flashes occur when the vitreous gel pulls on the retina. Flashes resemble sparklers, as in a fireworks display. Floaters and flashes are most common in men and women in their 40s, 50s, or 60s, although some people of every age experience this condition. Your doctor will perform a complete eye examination. Eye drops may be used to dilate your pupils.
Now, right about here. Good. That's perfect. Well, I don't see any problem with either eye in the front part. You can sit back, that's fine. Now look straight towards the end of the room. Good. Great. Everything looks fine there, too. Okay,
Your doctor may perform a scleral depression examination. There may be slight discomfort as the doctor uses a special instrument to see the rim of the retina.
Down again. And now up and left. A little higher. Good. Great. Okay, well, now I've looked all around your eye, and I don't see any problems.
Is there any treatment for those floaters or whatever they're called?
There is no good treatment for a simple floater problem. Often, floaters tend to settle down and drift out of the line of vision. If not, one must accept them as an annoying but tolerable and painless part of vision. Floaters also can occur when the vitreous gel becomes less solid, then collapses and pulls away from its attachments, pulling on the retina and possibly tearing it. This common process is called a posterior vitreous detachment, or separation, often referred to simply as PVD. Most people have no further complications. However, on occasion, during the process of vitreous detachment, the retina may tear. Retinal tears do not alter vision, but they may lead to retinal detachment, which may lead to loss of vision. All those who have a tear in the retina will not develop retinal detachment. But retinal detachment may occur often within 6 months from the PVD incident. If your doctor detects a retinal tear, there are 2 recommended treatments. Although not all tears need to be treated, treatment of certain kinds of tears greatly lessens the chance of retinal detachment. In case of a retinal tear with no fluid seepage underneath the retina, a laser may be used. Little burns are made around the tear to seal it and stick down the edges. Sealing the tear is also possible by using a pencil-shaped instrument which freezes the edges around the tear. This is called cryotherapy. Some doctors prefer one treatment over another, and some tears respond better to one treatment than to the other. A tear in the retina does not immediately damage the vision. Many people have tears, and many tears do not need to be treated. However, retinal detachment, a more serious ailment, is also possible, and most retinal detachments will lead to loss of vision if they are not treated. Retinal detachment occurs when fluid seeps through a tear, getting between the retina and dissecting it away from the back of the eye. At this point, the retina is removed from its source of nutrients and stops working. Retinal detachment may be recognized by a gray area or curtain coming over part of one's vision. There may also be a noticeable defect in peripheral or side vision. As the retinal detachment spreads to the center part of the retina, the central vision becomes blurry and is lost. If the fluid has seeped and caused the retina to begin to detach, retinal detachment surgery will most likely be required. Even if the retina is reattached surgically, the retina may not function again, and blindness may result. Fortunately, most patients with floaters and flashes related to PVD do not have retinal tears or retinal detachment.
Oh, good. How long will I have this floaters and flashing?
Well, they may continue for a while. You may see occasional floaters, and you certainly may expect to see flashing lights on and off. Usually the symptoms will diminish over the following month or so. If you notice a significant increase in either, or a significant change in the quality of either the floaters or the flashes, I think you should probably call the office and I'll see you promptly.
Although tears are often detectable during the initial examination, a follow-up visit may be suggested.
So your chances are very, very good of being able to maintain the good vision that you have.
If a problem occurs with your vision, an eye examination may determine the cause and allow the ophthalmologist to recommend solutions.
Oh, how beautiful are those for Grandma?